I am Dr. B. Ravi Shankar, gastroenterologist and hepatologist of Yashoda Hospitals, Secunderabad. Today we will take up some issues on gastrointestinal manifestations of COVID disease. Usually the digestive diseases comprise esophageal disease, gastric and intestinal diseases. So esophagus we have mainly gastroesophageal reflux disease, esophageal carcinoma. In the stomach we have ulcer disease commonly, and in the intestines we have diseases like irritable bowel syndrome, inflammatory bowel disease and the cancers. Okay, now if we see the COVID disease is predominantly a respiratory illness, a severe respiratory illness, but the severity varies from mild disease to severe symptoms, and it can be life-threatening. Apart from the respiratory symptoms, which could manifest in severe disease patients as severe pneumonia requiring ventilation, and some of these patients succumb. So the patients who have respiratory disease can have some gastrointestinal manifestations, and sometimes there could be gastrointestinal manifestations of COVID disease without having respiratory symptoms, and obviously these patients would be very difficult to diagnose. So what are the symptoms of gastrointestinal tract in patients with COVID? These appear like trivial symptoms like loss of taste, loss of smell, nausea, vomiting, anorexia, that is aversion to food, and sometimes diarrhea. So there could be certain liver complications like elevation of liver enzymes like SGPT and SGOT, which are called transaminases, may be elevated in COVID disease patients. And there also has been shown in some of the recent studies where COVID patients have been studied that there could be stool shedding of the virus. So is there any possibility of spread of the viral infection through food and water? Possibility is there. So overall, summing up, the common gastrointestinal manifestations are a little bit of nausea, vomiting, anorexia, and these symptoms could be severer in patients who have severe disease, and these symptoms could be predominantly found in patients who have severe disease. There could be another way of looking at it. So COVID disease patients may have gastrointestinal symptoms and sometimes liver manifestations, but what would happen to any patient who is already having coexisting gastrointestinal or liver diseases and who could get infected with COVID? Now, nowadays we are saying that only this many patients are getting infected, but we do not know whether COVID could become an infection which could be acquired by a number of people. So we have lots of chronic gastrointestinal disorders, like we mentioned in the initially, that some diseases like inflammatory bowel disease and so on and so forth, which could continue for life. And if these patients get infected or affected by COVID, what could be the outcomes? These are still totally not known, but we can anticipate with the previous SARS illness and the experience world over that some of these diseases could slightly aggravate, like probably a liver disease which is pre-existing might get slightly aggravated, but by and large a viral hepatitis, a stable cirrhotic, may not much get worsened with this COVID infection. And regarding the bowel diseases like acid peptic disorders might not get much affected, and inflammatory bowel disease also might not get worsened because of COVID. But there could be a slight modification in the way we approach the diseases during the time of COVID. Like, for example, if steroids are being given for inflammatory bowel disease, we prefer to reduce on the dosage or stabilize the dosage, and definitely not increase the dose of steroids when the bowel disease gets aggravated in IBD. But certain things like biologicals could be used without much problem. COVID infection can cause intestinal symptoms like diarrhea, but it doesn't cause dysentery. Dysentery is obviously bloody diarrhea, so it doesn't cause bloody diarrhea. It could cause diarrhea, and that is now well known, and it has been seen to the tune of 5 to 20%. In fact, majority of the series what have been published from China have shown that 5% of the people to 7% of the people have the diarrhea symptom, but very few studies have shown that the symptom could be found in a little more percentage of patients. But anyway, this could subside over a period of couple of weeks, and it would not be a much bigger problem. So diarrhea is a manifestation, but it subsides spontaneously, and it could get relieved by symptomatic management. Well, all of us do have the intestinal flora, but intestinal flora may not be able to protect us from COVID-19 infection, because the ACE2 receptors which are there in the respiratory tract and in the GI tract, the COVID virus enters through these receptors into the body and epithelium, and the body gets infected with this. But the microflora which is present in the large gut will not be able to protect the individual from the COVID infection. Whoever is having chronic disorders, if they get infected with the COVID infection, there could be some modification in the schedules of medication which we give. Like inflammatory bowel disease, it would be preferable to use biologicals if the disease gets aggravated. Majority of the other diseases like acid peptic disease, GERD, irritable bowel syndrome, pancreatitis, and so on and so forth, the same dosages of medication and the same way of treatment could be continued. But if the COVID disease becomes very severe and life-threatening, requiring ventilation and other supportive care, then the treatment for these disorders could be minimized and then carried out at whatever permissible level, and let the COVID infection be treated first, and then we can get back to the medication. So always there is a proposal that what could be the diets for preventing the infection. Presently we are in the midst of this pandemic, so we should eat well balanced diets, and we should take good bit of vitamins and do exercise and reduce the tension levels, and of course lead a healthy life, so that we don't get unnecessarily perturbed by the stress of acquiring the infection. Suppose we get the infection, we should isolate ourselves in a room and then stay away from the family members and prevent the spread to the family members, and everybody should take very scrupulous measures. And somebody who has acquired an infection for himself, he should not get scared. Routine simple measures will probably take care of the infection, and the percentage of patients who really become severe is a small percentage. We should hope for the best that we will not get into that severe bracket. But if at all something happens, like if somebody is infected and he has to reach the hospital because of the requirement of oxygen and other therapies, I think one needs to be bold and face the situation and take the treatment. Fortunately, I think in our country, the mortality with this COVID is around 2 to 3%. But still, it is unfortunate that we are in the middle of this pandemic, which has spread throughout the world and is having a real effect on the health of the individuals, and the economies of the countries are broken down because of this infection. And somehow we should find a way where gradually over a period of time we should be able to conquer this infection. And this infection causes, as you all know, severe respiratory symptoms in a small percentage of patients. It causes respiratory symptoms in a majority of the patients. It infects, and majority of the people could escape the infection. So whoever gets affected with the disease, I think they should be bold enough, they should be bold, and they should take care of themselves and their families. And majority will not have the severe disease, that is the plus point. And a small minority, they should get the treatment. There are a lot of specialists, intensive care specialists, pulmonologists who take care of their problem, and we should hope for the best.